This is the story of Johnny Tsunami, a tale of trauma and triumph. It was a sunny spring day at Leo Carrillo State Park. Johnny Tsunami, a 21-year-old male, had just gotten out of his med-surg class and decided to catch some waves to get his mind off of his latest test score. The surf was perfect. It was exactly what he needed. His Loma Linda was the last thing on his mind as he paddled out into the waves. After he paddled a fair distance from shore, Johnny closed his eyes, appreciating the deep sense of calm that the ocean gave him. This moment of peace was quickly disturbed when he felt something forcefully bump into the side of his board. Startled, Johnny looked over at the source of this disturbance. What he saw was far scarier than any NCLEX question. It was a great white shark, and a massive one at that. Its dorsal fin towered out of the water as its colossal, torpedo-shaped head slowly turned to face him. In an instant, the shark lunged at Johnny, and he was pulled beneath the surface. It was his left arm that the shark had grabbed a hold of, and as its jaws clamped down, Johnny could feel every tooth tear through his flesh and then grind against a bone. The pressure on his arm continued to build, and then it was suddenly released. Johnny couldn't believe the shark had released him, but as he turned to swim towards the surface, he realized the grim truth. His arm was gone, and the stump that remained stained the water a sickening shade of red. As soon as Johnny reached the surface and gasped for a breath of fresh air, the shark had grabbed a hold of him again. This time, its jaws were clamped firmly around his torso. The shark began thrashing, and Johnny's legs were slammed against coral and rock. He felt his leg break, and his ribs crack, and the world around him began to go dim. But Johnny knew he couldn't give up. He had a discussion board due at 5 p.m., and he was not gonna miss it. With the meager strength he had left, Johnny swung his right fist at the face of the shark. Amazingly, he managed to strike the shark at its weakest point, the very tip of its nose. The shark released him immediately and writhed in agony. It then retreated into the depths in shameful defeat. Unbelievably, while at the brink of death, Johnny managed to flounder his way back to shore. As soon as he reached land, he collapsed. Face down in the sand, Johnny's world went dark. Luckily for Johnny, the lifeguards who witnessed the whole scene tended to him immediately. They activated the emergency response system, initiated C-spine precautions, and administered oxygen via bag valve mask. They then applied an emergency tourniquet and packed his wounds. Within minutes, a medevac helicopter arrived at the scene and paramedics loaded him on board. A quick assessment revealed troubling findings. Johnny's blood pressure was 78/65, his heart rate was 167, and his respiratory rate was 43. His SpO2 was 81 and was quickly dropping. His temperature was 36.4 degrees Celsius and his Glasgow Coma Scale score was 11. Paramedics noted breathing that was fast and labored, with asymmetric chest expansion and use of accessory muscles, but no paradoxical movement. His breath sounds were absent on the left, diminished on the right, and his trachea was slightly deviated to the right. A sucking chest wound was discovered on the left side of his chest. The keen paramedics knew exactly what they were looking at: a tension pneumothorax. They immediately performed a needle thoracostomy and applied an occlusive dressing to the chest wound. They also inserted an 18-gauge IV in his right antecubital and began infusing a 1-liter bolus of lactated ringers. They continued ventilating him. One paramedic prayed quietly. In a few short moments, they were landing at VCMC, a level 1 trauma center. When Johnny was brought in from the ED, his vital signs were slightly improved. His blood pressure was 84/68, his heart rate was 158, his respiratory rate was 36, and his SpO2 was 88. His Glasgow Coma Scale score was still 11, and his temperature was 36.5 degrees Celsius. Assessment findings revealed shallow and rapid respirations, cool and clammy skin, deep lacerations on his chest and back, a left arm amputated at the elbow, and a compound fracture of his right tibia and fibula. Johnny was confused and lethargic. The emergency room trauma team proceeded with his care.
The trauma team quickly performed their primary survey following the ABCDE algorithm. His asymmetrical breathing pattern and tracheal shift were of most concern, followed by his significant hemorrhaging, pale, cool, and clammy skin. His GCS remained an 11 as the team cut off his wetsuit and covered him with warm blankets. The secondary survey was performed by the trauma attending, where they completed a detailed head-to-toe and took a thorough health history. Along with his multiple injuries, the team discovered that Johnny had no significant past medical history. He had no medication allergies, but the last thing he ate was a chorizo and egg breakfast burrito from Ola's at 0600. Immediately, the team placed Johnny on 15 liters via non-rebreather at 100% FiO2. The attending physician placed a chest tube to treat the tension pneumothorax. Meanwhile, the trauma nurse placed another large bore IV and began rapid fluid resuscitation with crystalloids, colloids, and blood products. Phlebotomy drew labs as Johnny underwent a fast ultrasound. He was then rushed to CT for a scan of his head, chest, abdomen, and spine. As soon as he was rolled back to the trauma bay, 3 eager CSU Channel Islands nursing students came to help to transfer Johnny onto a gurney to swiftly rush him to the OR for surgical debridement and closure of the amputated limb.
Several days following Johnny's surgery, he was stabilized on the med-surg unit. The nurse's top priorities were treating his infection, wound care, and helping Johnny come to terms with the loss of his limb. For several days, Johnny's white blood cell count was elevated to 21,000. He developed aspiration pneumonia from the seawater and was even showing risk for DVT because he refused to ambulate. Johnny was struggling. He was so depressed and anxious that he refused to eat, resulting in a drop in his albumin levels to 2.3. While his classmates roamed around the hospital, continuing their med-surg clinicals, he had become the patient.
He struggled with phantom limb pain, PTSD, and was in such denial about the amputation that he refused to look at his residual limb. It was time to get case management more closely involved. The case manager helped coordinate Johnny's care by involving psych, physical, and occupational therapies. He even helped connect Johnny with an amputation support group. Shortly after being discharged home from the acute rehab unit at St. John's Regional Medical Center, Johnny joined the amputee support group as was suggested by the case manager at VCMC. Through this interaction, Johnny learned that he was actually a gifted motivational speaker. After changing career paths, Hollywood got a hold of his story and is currently in the process of making a movie loosely based on his ordeal.